the fear that so many doctors have of psychosis. Not all of them. I've actually talked to 3 different healthcare providers about my experiences, and they're just like, that's fine. Watch it, obviously, but that's fine. But a lot of the times they are terrified of it, and you can tell they are, and I understand why they are. People with psychosis are unpredictable, especially if they feel offended by you or discredited or disbelieved by you. They often turn on you, and if you are diagnosing a person's psychic or psychological experiences as necessarily invalid as a sickness that needs to be remedied because the symptom of having that kind of mental experience itself is pathological and unacceptable, yeah, they're not going to be happy with you. And that's going to make them feel scared, and that can make them turn into themselves and focus more on the delusions and more on the hallucinations, and that, of course, will make the symptoms worse. Modern psychology mostly solves this problem by throwing mind-numbing medications at people. These literally change the structure of the brain and are known to reduce IQ points. So does psychosis that's untreated. Let's not lose sight of that. But it's not encouraging when any mode of treatment we have, or non-treatment for that matter, leads to roughly the same outcome in the long term. And these drugs, they have horrible, horrible side effects. They directly target dopamine in the brain much of the time, which means that very often you can't enjoy anything. At least that's what I saw in my partner. I'm not saying no one should take them. If you have psychosis that you cannot manage without them, do take them. They're very useful drugs. But they are basically the dark ages of medication. It's like treating mania with mercury concoctions. If it helps, great. But we need to find something better.